Dear students, welcome back. In the previous session we have discussed about tibia. Now in this session we are going to discuss about fibula. So the other names for fibula is called as brooch bone, splint bone, calf bone, os peroneum. These are the different names given to fibula. Okay. So here this fibula again which is derived from Latin word, okay, that means the word meanings to fix, okay. So this fibula is the lateral bone of the leg. So tibia is the medial bone of the leg and this fibula is the lateral bone of the leg, and it is a slender bone with slightly expanded ends. So this is a slender bone with slightly expanded ends and it is having a twist, okay, and this one is also having a shaft and it is having an upper end and the lower end. This upper end is called the head and the lower end normally called as lateral malleolus. Okay, both the head and the lateral malleolus can be felt subcutaneously. We can feel it, okay, on the lateral aspect of the leg. We can feel the head of the fibula as well as the lateral malleolus at the lower end. Okay, now we will see the side determination. How can we differentiate the sign? Actually this is the right side fibula. How can you differentiate this right side? The upper end is irregularly expanded in all directions. So the upper end is expanded irregularly in all directions. So the lower end is flattened. Okay, when compared to the upper end, the lower end is flattened from side to side. From side to side, it is flattened and forms the lateral malleolus. Okay, so up to this one, upper end is irregularly expanded and in all directions. If the lower end is flattened from side to side. If you see the medial side of the malleolus, so this lateral malleolus which is having a medial side, so this malleolus bears a triangular articular facet. It is having a triangular articular facet which articulates with the talus. So a triangular facet is present on the medial side of the lateral malleolus, okay, which articulates with talus. Okay, posterior to the articular surface. So we will see on the posterior aspect. Yes, so posterior to the articular surface, the malleolus shows a deep fossa. So here you can find the fossa here. Yes, here you can find the fossa here. This is called as malleolar fossa. This is called malleolar fossa. Okay, so posterior to the articular surface, the malleolus shows a deep malleolar fossa, and this fact enables the anterior and posterior aspects of the bone can be distinguished from each other. Okay, so this is the thing you have to keep it in mind. Okay, yes. So again we will see this anterior aspect. So the side to which a fibula belongs can be determined with the help of this information. That means the upper end is irregularly expanded, and if you see the lower end which is flattened side to side, and it is called as malleolus. To this malleolus on the medial aspect, it is having a facet, and posterior aspect to the facet, it is having a fossa. So that is called as malleolar fossa. So with these features we can identify the side. Okay, and also with the help of this malleolar fossa we can differentiate the bone into anterior and posterior aspects. Okay, now we will move on to the upper end. The upper end of the fibula is also called as head, and it is approximately cuboid, which the upper end is approximately cuboidal in shape. Its posterior and lateral part shows an upward projection called styloid process. So on the posterior aspect we can see, so on the posterior and lateral aspects it is having a projection called as styloid process, which is also called as apex of the head. Okay, and in front of and medial to the styloid process, the head shows a circular facet for the articulation of the tibia to form a superior tibiofibular joint, and this facet is directed upwards and medially. So here we can find that facet, that is tibial facet. So normally the styloid process we can well appreciate on the posterior aspect, and the facet, the circular facet, we can appreciate on the anterior aspect. Okay, that this facet is present upwards and medially. Okay, so the part of the bone immediately below the head is called as neck. So this is neck. So this part below the head we can call it as neck. Now we will move on to the shaft. The surfaces and borders of the shaft show some considerable variation from bone to bone, okay, and may be difficult to identify. Okay, already this bone is a very slender bone, and the borders will show variations from bone to bone, and which is very difficult to identify the borders and all. Okay, and however the shaft is completely surrounded by the muscles. Okay, the shaft is completely surrounded by the muscles. So it is having three borders. Okay, so the shaft has three borders, namely anterior border. Okay, next one is the posterior border, another one is the interosseous border or medial border, and it is also having surfaces, that is anterior surface, okay, lateral surface, and we can see this posterior surface, some of the posterior surface in the anterior view also. Okay, now we will see all these borders and surfaces now. Okay, yes, now we will see the first border, that is anterior border. Okay, yes, the anterior border is short, though it begins just below the anterior aspect of the head. Okay, and it is identifiable only at its inferior aspect, only at its inferior aspect. Okay, it starts immediately just below the anterior aspect of the head, and it is identifiable only at its inferior aspect. Near to its lower end, okay, near to its lower end, it turns laterally to join the apex of the subcutaneous triangular area of the shaft above the lateral malleolus. So here at the lower end, so this anterior border is going to turn laterally to join the apex of the subcutaneous triangular area of the shaft which is above the lateral malleolus. We can find here the triangular area. So here at this area this anterior border is going to end up. Okay, now so the triangle itself is indicative of the inferior end of the shaft. So the triangular area which helps that is the end of the shaft. The anterior border and the lateral aspect of the bone. Now the upper end of the posterior border, okay, this upper end of the posterior border lies in line with the styloid process. Okay, that one we can see on the posterior aspect. Yes, so we can see the posterior border here. So this posterior border lies in line with the styloid process. Okay, its lower end reaches the medial part of the posterior surface. Okay, this border, medial border of the posterior surface. Here, this is the border. At the lower end, it reaches the medial part of the posterior surface of the lateral malleolus. Okay, this is the posterior border now. Okay, this posterior border runs here and it is going to end up here. Okay. Next, now coming to the introversious border. So this introversious border again we have to see in the anterior aspect. So the introversious border lies very nearer to the anterior border and may be indistinguishable and form the later in the upper part of the shaft. So this is the introversious border now, this which is very much close to the anterior border. Okay, and when traced downwards it passes medially and merges with the upper part of the rough area above the talar facet of the lateral malleolus. So if you trace the border here and it will move to the upper part of the rough area above the talar facet of the lateral malleolus. So these are the borders. Okay, now if you see the lateral surface, it lies between the anterior and posterior border. So posterior border and the posterior aspect. The lateral surface is present in between the anterior border and the posterior border. Because of the lateral inclination of the lower part of the anterior border and the lower part of the lateral surface faces backwards and become continuous with the posterior aspect of the lateral malleolus. Okay, because of this angulation, this lateral surface will falls onto the or faces backwards and becomes continuous with the posterior aspect of the lateral malleolus. If you see the medial surface, okay, so the medial surface is very narrow, so it is present in between anterior and introversious borders. So this much only, anterior and introversious border or medial border. So the medial surface is very narrow. Okay, in the upper half of the shaft. In the lower it is broad. In the lower the medial surface is broader and faces as much forwards as medially. So the medial surface will have more space on the anterior aspect. So sometimes it is also giving the name as anterior surface in the lower part of the shaft. Now we will move on to the posterior surface. Okay, so here we can find the posterior surface. So this posterior surface lies in between the interosseous borders and the posterior borders. This interosseous border is present on the anterior aspect. We can see the posterior border. Okay. So this posterior surface lies between the interosseous and posterior borders. It occupies a very large area of the surface of the shaft. Over its upper 3/4, it is divided into two distinct parts, medial and lateral, by a vertical ridge called as medial crest. So this medial crest divide this posterior surface into medial part and then the lateral part. Okay. Afterwards, this ridge which runs downwards from the neck for 2/3 of the bone length, which is more prominent. Okay. So on the anterior aspect, this medial crest is more prominent. Okay. So if you see the medial crest here, so this one is more prominent on the anterior aspect. Okay. And then this ridge in the lower part, it curves forwards to join the interosseous border. So this medial crest at the lower end, it curves forwards to join the interosseous border. The nutrient foramen of the bone is found near the median crest. So we can find the nutrient foramen near the medial crest. Okay, the medial part of the posterior surface is deeply concave and faces forwards and medially. The flat lateral part of the posterior surface faces posteriorly in its upper part and medially in its lower part. Okay, the lowest part of the posterior surface lies just above the talar facet and the talar facet of the lateral malleolus. Okay. This part is roughened for the attachment of a strong ligament that connects the fibula and tibia. Okay. So this is about the posterior surface. Okay, because of twisting of this bone, we can find such variations. The borders are also having some borders which start at the anterior side and it is going to end in the posterior side or the lateral side. Like that we have seen about the borders of this bone. Okay. Now if you see the lower end of the fibula is called as lateral malleolus. It has a convex lateral surface. So again we will move on to the anterior aspect. So it is having a convex lateral surface. So it is having a convex lateral surface here, and that can be felt through the overlying skin. This surface is continuous above with the triangular area on the shaft. The medial surface of the malleolus bears a triangular facet. The apex of the triangle being directed downwards, the facet articulates with the lateral surface of the talus and forms the part of the ankle joint. Just above the facet, the lower part of the shaft shows a rough area behind the facet. That is called the medial surface of the malleolus shows a deep malleolar fossa. The lower end also has a posterior surface which is having a shallow groove. So this one is the shallow groove. Okay, this shallow groove on it, and it may be noted that the lateral malleolus projects to a lower level than the medial malleolus. This groove shows that. Okay, the lateral malleolus projects to a lower level than the medial malleolus. For example, this is the tibia. Okay, this is the medial malleolus, and the lateral malleolus is present below this level of medial malleolus. Okay, so this is all about the bony parts of the fibula. In the next session we are going to discuss about the attachments of the fibula. Thank you.